up there.
Just go right in there. I made your spot.
We will be recording this for educational purposes, and also if anybody couldn't attend the Zoom. All right. Anybody else that has just been admitted, if you want to, you can go ahead for the biggest drawing this year, go ahead and put your name in the chat box. And if you have trouble getting that in the chat box, just shout your name out loud for us, okay? All right, perfect. And we should have our closed captioning available as well. We've got one more person joining here. We're going to start in about 30 seconds. And anybody that has recently joined to put your name in the drawing, you can put it in the chat box, or you can shout it out and we'll make sure get your name in the drawing there. And I've got Alana as well, Brittany, to be added to the drawing. All right. Okay, so we're going to go ahead and get started here. First of all, my name is Dr. Paige Gainey, and I'm an audiologist at Total Hearing Care. I work between our Glen Lakes office, which is Walnut Hill Lane and 75, and then also our Abrams and Mockingbird office. I want to first thank everybody for attending. We're so excited about this because this is our biggest Zoom event of the year, and we also have the best prize giveaways this time. So first, I want to go over a little bit about Total Hearing Care and what we do, what we believe here at Total Hearing Care, and then I will give an introduction to our guest speaker, Dr. Matthew Webster, who is one of our newest audiologists here. So Total Hearing Care, we have 5 locations. We have our Abrams and Mockingbird location. We have our Glen Lakes, which is pretty much Walnut Hill Lane and 75 location. We go up north a little bit at our Coit and Campbell location. And we recently opened up a Plano location off of Spring Creek as well. We also have our East Lake Garland location to help you. Here at Total Hearing Care, we work with hearing disorders, tinnitus difficulties, and hearing devices that help with them. We have 6 audiologists to help you at any of our locations. If you have any questions or concerns, we are directing all of those to our Glen Lakes office, which is where I'm at right now. And I'm going to give you a phone number, and it's also going to be in the PowerPoint. If you have any questions, you can always come up here and ask or talk to Brittany, our front office staff. Of course, we can always, she just waved. You can always get help at any of our other offices, okay? But this office location phone number is 214-987-4114. And again, that number is 214-987-4114. Okay, so today we're going to talk all about tinnitus. And so we have Dr. Matthew Webster here, and he's going to go in a little bit about himself and what got him in the field and what he likes to do. And then he's going to get started on that PowerPoint. And then, of course, this is very interactive, very casual. So if y'all have any questions or think of, hey, just shout out and ask or type it in the chat box. Or if you want to leave the questions till the end, that's completely up to you. But all right, Matthew, I'm going to hand it over to you.
All right. Thanks, Dr. Gainey. Let me get my PowerPoint up here and I'll jump into things here. Okay.
while he's getting that pulled up, I've got our cute little gifts back here that we're going to be giving away. So I'm just going to show those off. So make sure that you put your name in the chat box or shout it out. Here's some more gifts here too. So we're excited to be giving those away.
Where's my little present button? There we go. All right. So I'm Dr. Webster. Thanks everybody for coming. I am, like Dr. Gainey said, a new audiologist at Total Hearing Care. I went to UT Dallas for my graduate degree, and I did my residency year in a private practice in Phoenix. And now I'm back in Dallas, so I'm happy to be back. I got into audiology because I am a musician. So sound has always been important for me. And I love helping people hear better, change the way that they're hearing, and reconnecting people. So that's kind of how I got in the field. Special interests include hearing aids. I love tweaking and fine tuning hearing aids, getting that last bit of performance out of that hearing aid is fun for me. And then tinnitus as well. So that's what we're going to be talking about today. I have a presentation for you on tinnitus in 2022, right? So it's kind of a hot topic. There's a whole lot of crazy treatments out there on the internet, like there is for anything, but tinnitus is a subjective thing to begin with. So it's kind of a tricky thing to navigate for most people, and rightfully so. So we're going to go ahead and jump into it here. Okay, so an overview of what we're talking about, some questions I'm going to try to address or answer is, first of all, just what is tinnitus? Where does tinnitus come from? How do we treat tinnitus? And what treatments are emerging or in development? Okay, so technically there are two types of tinnitus. What we're going to be talking about today is subjective tinnitus, which is the most common form of tinnitus. And the technical definition here is the perception of a sound in the absence of a corresponding external sound. So it's a sound that doesn't really exist to other people. It's purely in your head, or it's purely your own experience. We can understand tinnitus as a symptom of an underlying pathology rather than
things coalesce, then we get to be pleasantly surprised.
I got it taken care
of. Okay. So excuse me. So just some stats here for you. Like we said, subjective tinnitus is the most common subtype of tinnitus. Prevalence is, this is kind of a hard metric to get, because again, it's a subjective thing. A lot of people don't even speak up about their tinnitus because it's not bothersome, but it estimated about 10 to 15% of adults have tinnitus. Now that percentage is not, or that metric is not those with bothersome tinnitus per se. Those are just people that notice some kind of sound in their head. Tinnitus is correlated with hearing loss. Most people with tinnitus also have hearing loss, but it doesn't go the other way around. Just a little fun fact for us there. Moving on. We have a hand raised. Judy, did you have a question for us?
No, I'm sorry.
Oh, no worries. Okay. So just a little history on tinnitus. Tinnitus has been around a long time. A lot of people think, oh, I wore my AirPods or my headphones and now I've got tinnitus. It's actually been around forever. So we've got Egyptians in 2000 BCE believed that tinnitus was some kind of curse, right, in your ear. They tried to develop treatments and medicines for it to kind of expel the curse or whatever, but there's evidence of Egyptians dealing with it. We also have the Greeks dealing with this external sound. They try to drive it out with other sounds like the ocean or music, etc., which is they're relatively on the money with that one. That's certainly one way to handle it. And then there's also mentions of tinnitus in ancient Hebrew texts. So point being, it's been around forever. And it's still a bit of a mystery for us, but we do know some things. And we're going to talk about what progress we've made on it, where we're at with our understanding of tinnitus. So let's see. What causes tinnitus? That's a tough question to answer. We really can't answer that. What we can answer is what is correlated with tinnitus. Okay, very different things. The cause of tinnitus is unknown. It can be coming from so many different things. Like we said earlier, it should be thought of as a symptom of an underlying pathology. So that makes it real complicated to figure out where it necessarily comes from. But again, we know some factors that are correlated with tinnitus. So let's go through those. First, we have aging and age-related hearing loss, noise-induced hearing loss. So certainly if you are wearing headphones and playing that music way too loud, that's could potentially put you at risk for some noise-induced hearing loss, which again is a correlation with tinnitus. Next is head or neck trauma, middle ear issues. So if you have a perforation in your eardrum or chronic ear infections, right, that's correlated with tinnitus. Poor cardiovascular health, Meniere's disease, and auditory tumors.
And Dr. Webster, I
Yeah.
have a friend, this is interesting, she was wrestling with her 2-year-old and playing around, and she said she moved her neck a certain way and she heard a pop. And ever since then, she has had tinnitus. And she was like, Paige, is it ever going to go away? What happened? And you're exactly right. Like head or neck trauma, just even that little movement, and she heard that pop can cause it. So it's very interesting. Some of those things that we don't think could have caused it, because it's not just, or not caused it, correlated with it.
Triggered it, right?
Triggered, yeah, exactly. Yeah. It could be something as a small movement like that.
Absolutely. And that's a great example of it being a symptom of something else, right? So that's how your friend's tinnitus came about. The next guy might have a totally different story. So that's why it's really hard to say necessarily what is tinnitus, where did it come from, right? But certainly for that individual, it seems like it was certainly triggered by that event. Yeah. Thanks, Dr. Gainey. All right. So I want to talk about, there's two components to tinnitus. This is more talking about, who's bothered by tinnitus, how much does it affect your life? So subjective tinnitus, two components. We've got the perceptual component and then the emotional component. So some people, if I do a tinnitus evaluation and their tinnitus is just crazy loud, I'm like, dude, how can you hear anything? That tinnitus is rough. You must be hating that. And they don't care. They're fine. It doesn't bother them. They're just whatever about it. Other people, they'll have the quietest tinnitus and they'll just be absolutely consumed by it because it's just very bothersome. That's that emotional component, right? So how it affects you emotionally is a huge element to the tinnitus as a whole, right? So if your reaction to the tinnitus is quite negative consistently, you're going to probably report more bothersome tinnitus, and that's more or less out of our control, but it is certainly something that we consider when we're looking at the big picture of tinnitus.
And Dr. Webster,
yeah,
we have John here, and he has a really quick question that like assists in the brain, specifically.
Just going by there at 4 o'clock today.
No, in one moment. There we go. the arachnoid cysts, and if that's any sort of impact or cause on tinnitus. And what I found, I don't know what you found, but it can present with symptoms such as, dizziness, tinnitus, and or hearing loss. And sometimes they can just be asymptomatic, but what they have found that there is, a cause or impact from that type of cyst in the brain. Absolutely. So that's a
Oh, you
good.
came back?
Yeah,
Fine,
absolutely.
thank you.
Yeah, so certainly some cases are a little bit more of an obvious, yes, this is what caused it, right? Breaking down like why it's like, can you see it on, can you visualize the tinnitus on a brain scan? That's a whole nother story. Like what is it, right? But absolutely, there's some clearer cases where a tumor certainly would make sense to be the culprit there. So right now, on the screen here, we've got some effective tinnitus treatments. So these are treatments that are currently researched and backed by professionals in the field that have been shown to work for tinnitus patients. Now, the first one is sound therapy. This includes listening to white noise or treating a hearing loss with hearing aids. So just essentially the concept is getting sound into your head that's not the tinnitus, right? So you're just listening to other things, and your brain and your attention goes towards the things that are actually in your environment rather than listening to the ringing in your head. So the first thing I always try with my tinnitus patients is, if they have a hearing loss, we try hearing aids, because listening to your environment, listening to your surroundings, the birds chirping, the leaves rustling on the ground, that's all real stuff. That's helpful information to begin with. And if it knocks out your tinnitus, awesome. If if we don't have to listen to ocean waves for the rest of your life, then I say let's go with just the traditional hearing aid and make that work for us. Now, if that doesn't work, then we consider some alternative routes. A lot of times what people can do is, if their tinnitus is, they're having a bad tinnitus day, it's kind of flaring up on them, we'll create a program on the hearing aid that'll play some ocean waves or some kind of customized sound to target your tinnitus frequency. That'll help it kind of help you manage that sound, and it'll kind of put it in the back of your mind rather than on the forefront of your mind. So there's a range, but sound therapy, right? So introducing more sound into your brain there. The next one we have is cognitive behavioral therapy. This is kind of managing your reaction to tinnitus retraining therapy, and mindfulness. These are all, I'm not going to go into breaking them down in too much detail, but essentially these are more like psychotherapy. You're working with a therapist to manage how you're reacting to the tinnitus. So focusing on thinking about your negative emotions, negative reactions, and how you can modify that when you're feeling bothered by the tinnitus. So it's kind of learning, those bottom three are kind of learning how to live with the tinnitus and let it go. Ideally, if you have less stress and anxiety, that tinnitus can get a little bit quieter. So that also helps kind of break the cycle there. But sound therapy, if that's definitely the place to start a lot of times, if there's a hearing loss, because you kind of get two birds with one stone there. You're helping a hearing loss and you're knocking out the tinnitus pretty easily. And again, that's variable efficacy. You kind of got to try it and see if it works for you. So this is an interesting one. These are the ones that are emerging or still lack evidence, right? So a lot of people will come in saying they bought some magic beans online and it didn't help their tinnitus. And they know it was kind of a shot in the dark, and you get desperate. I get it, so it's nice to know what's out there and what's kind of gimmicky and what maybe works. So these are some things that maybe work, but certainly don't have enough evidence for me to recommend necessarily for your tinnitus. So
And
first,
now that we're talking about it, it's all gonna pop up on our Facebooks because our phones are going to say it's gonna
yes,
be
great.
magic beans for tinnitus. It's gonna pop up on
Absolutely.
all of our
Yeah.
Facebook now that we're talking about it.
Nobody buy any magic beans.
Yeah.
All right. So vagal nerve stimulation. This is something that's been used to treat anxiety and depression and stress. And the rationale for doing this for tinnitus is that those people with tinnitus have all of those things. They have anxiety, depression, stress, right? So if they can target relaxing your sympathetic nervous system, that's acting up and causing that anxiety and depression and stress, if they can target that and minimize that, then theoretically maybe your tinnitus will get a little quieter. It'll become more mild. Any sort of relief is what they're looking for there. Now the studies aren't saying that yes, this is working necessarily. It's still pretty hit or miss. The issue is the placebo effect in all of these studies end up trumping the experimental group. So you give some people will literally get a magic bean in the study and they'll say, oh yeah, my tinnitus is better, when really we gave them just a bean, right? So it's tough because the placebo effect has some real power to it, but that's not what we're looking for. We're looking for objective improvement. And these, again, are some interventions that aren't quite proven to objectively work. The next one is deep acupuncture. Deep acupuncture actually achieves the same effect or a similar effect at the level of your brain as vagal nerve stimulation. So this one is, again, using that same rationale. If we can target reducing anxiety, stress, depression, we'll see some improvement there. Pharmacotherapy is that's probably the category where we would put the magic beans. There's nothing that necessarily that really works. There's nothing, I shouldn't even say really work. There's nothing that improves your tinnitus in from a pharmacy, right?
Have you heard of the lipoflavonoids?
Sounds familiar. What are we talking
Yeah,
about?
it's like let me try to search it, but I was reading some interesting research on that. But it's like you have to take it. There's no proof for it and there's no proof against it. And you have to take it quite a bit. And they say that it helps for Meniere's and tinnitus, but and it says you have to take it consistently for 60 days, and it's quite a bit each day of that 60 days. But I thought that was interesting that it's been neutral research on that.
Yeah, so I mean, that's pretty much like all of these things on this list.
Yeah.
Or one study, yeah, it works. The next study, no improvement, doesn't work. So we can't get if like what you're doing to be able to say that something works, you have to do a study and it gives you a green light, says yes, it worked in this study. Then another lab can do that same study and they need to get the same results. And if they don't, then we say it's not effective. Right. So if it's not replicable in another lab, then we can't really back it. But certainly there are things out there that may work. I'm not saying, I'm not trying to crush anyone's dreams here, but
yeah. And John, it was interesting. He commented to everybody and he said he tried it for 45 days and it didn't have an impact on him. So, that's just interesting. I mean,
absolutely. Yeah. Yeah, so far there's one very specific type of tinnitus called typewriter tinnitus that you can treat pharmautically, but that's usually not what we're dealing with. So for traditional subjective tinnitus, there isn't anything that's proven to alleviate that.
is the typewriter tinnitus that sounds like a typewriter or? Yeah, okay. That I've never heard a patient say that's the kind of tinnitus they have.
Yeah. It's just I think it's not entirely subjective too. So
Got
it's
it.
a little bit different, but yeah. Then we have deep brain stimulation. There was some studies in Europe, as well as transcranial magnetic stimulation. Some studies in Europe that are showing that very severe, extreme cases of tinnitus are helped to some extent. Some of those cases are helped to an extent with these two kind of experimental therapies, but nothing that's necessarily available for us right now, unless you went to a research lab and tried to participate in the study and say, hey, I'm open to just trying something here, which you can do. I don't really recommend trying anything that requires surgery unless you're really, well, that's a whole nother story. Depends on what we're talking about. But with that said, those are things that are up and coming, emerging in the research field. So my recommendations, this is my last slide for you guys. Recommendations, medical evaluation, always want to get checked out by a physician just to make sure there's no medical issues like a physical red flag for a tumor or something that is objectively causing that tinnitus. And then certainly you want to get a hearing evaluation. Tinnitus and hearing are hand in hand. They go hand in hand. Like we said earlier, there's some correlations there. And then a tinnitus evaluation. So ideally you go somewhere for your hearing evaluation that will also do a tinnitus evaluation for you. And you can kind of speak with that audiologist on what you can discuss your symptoms, what your experience is, and some treatments or solutions that might help alleviate that. And it is somewhat of a trial and error process. There's not a simple solution for everybody, right? You got to work with the audiologist to figure out what's going to work best for you. So I will leave it open for questions here, but thank you everybody for coming and listening. Does anyone have any questions for me?
Yeah, everybody, if you can shout out your question or type it in the chat box. While y'all are thinking of some questions there, and we love questions, I'm going to just remind everybody to type your name in the chat box or shout it out loud, because we have some gift cards coming around that we're going to give out. We also have some other wonderful gifts here. And so we have a question from Alicia. Well, good to hear from you, Alicia. She says, is it common for it to get worse at night while laying in bed? That's a good question. Dr. Webster, do you want to answer that?
Yeah, sure. So I would say, yeah, it's certainly a common finding that we hear, or a common report. A lot of times this kind of goes back to sound therapy. At night, generally, it's going to be quieter. You're not hearing as much sound from your external environment, which kind of just leaves you alone with your tinnitus, and it a lot of times just feels louder in those times when it's quieter, which a lot of times again is at night. So that is a common complaint to report.
Excellent question. Any more questions for me or Dr. Webster?
Hey, thank you all for putting this on. Quick question. When you talked about the therapies, cognitive-based therapy, sound therapy through a listening device, a hearing aid, is there any data that would give you like efficacy of those? What is it? Just so individual based on the individual case, or
there's
on that?
Yeah, I don't have the numbers off the top of my head, but there's tons of research saying that hearing aids, treating a hearing loss with hearing aids significantly improves tinnitus symptoms. So it's not necessarily, oh, it might work, it might not work for you. Most of the time you're going to get some tinnitus relief. So for a lot of people, it's quieter. It's objectively quieter to them, the tinnitus, right? And at the very least, it having the hearing aids and being able to hear your sound to the fullest extent, it helps you escape the tinnitus much easier. It helps you put it in the back of your mind much easier, because you have a lot of other stuff taking your attention that's more important. So at the very least, we have that, right? So, but most cases, you're going to have some at least slight reduction of the intensity of the tinnitus.
Makes sense. And then I can ask one follow-up, just
Sure.
would that extend when you take the hearing aid out? In other words, is there any type of muscle memory that's occurring there, or is it only when that's in?
Yeah, so it does have there's a phenomenon we call residual inhibition. So yes, it does carry over even after you take those hearing aids out. Now, again, it's not everybody, but there's a majority of people that it does in fact carry over and help.
Great, thank you.
Mm-hmm.
So I found about an 80% of patients say, hey, my tinnitus is lessened or gone. The other 20% say, it's still there, but I hear better. But when I look at research, they say like 60% of patients experience some sort of relief through the use of hearing aids alone. So that's what research across the board has said. We have some more questions here. Stephen said, mine gets worse when my head is congested. I've been wearing hearing aids for 3 years and have not seen an improvement with the hearing aids. In the winter, it is much worse than during the summer. So allergies, sinus relation, it can absolutely impact the tinnitus, because it's all pressure related. All of our fluid in our middle ear system, our balance and whatnot, is all the same fluid. Do you notice? I'm just curious, Stephen, if you want to let us know, are your hearing aids specifically just for the tinnitus, or is it for hearing loss and tinnitus? Do they help you hear better at all?
My hearing aids are for hearing loss, and they work very well for my hearing loss. But I still, even with the hearing aids in, I still hear ringing, and probably 90% of the time.
Probably 90%, yeah. Yep. So then, that sounds like you're part of that. If 60% of patients notice some relief, maybe you're part of that 40% that, just it helps you hear better, but it's your tinnitus is still there 90% of the time. Does it ever keep you up at night?
No, I've got, it's funny. I went for an MRI yesterday and fell asleep in the MRI, so I can sleep through anything.
So you can sleep with that.
So if I can sleep through an MRI, it's not going to impact my sleeping.
Thank you, Stephen, for commenting and letting us know. We love this input and questions from patients. We have another question, Milano. When it seems like I can hear my heartbeat in my ears, is that tinnitus? That is a great question. Dr. Webster, let's have you answer that one.
Yeah, so technically it's not necessarily tinnitus. Dr. Gainey, what would we call that?
The pulsatile tinnitus.
Yeah, so it's kind of it's more of an objective tinnitus. You are hearing an actual sound, and it happens. It comes and goes. Yeah.
And do you notice it, Alana, in one ear or both ears? She said both. Okay. Yeah, so it can be sometimes in one and both ears. Sometimes it can be related to an underlying condition. So anytime a patient reports pulsatile tinnitus, we do recommend seeing an ENT just to get that double checked to make sure there's not like an underlying condition. These are great questions and great comments. I love it. Anything else?
Dr. Gainey, can you hear me?
Yes, I can hear you.
Okay, this is Linda. Hi, Dr. Webster.
Hey.
I just wanted to ask this question. I have to say, I've had tinnitus for a while, but it wasn't very bad. And I know I've brought this up to you before, but just curious about anybody else. I had COVID 2 years ago and then again last year. And boy, it really seemed to affect my tinnitus after that. It just really worsened. And I'm okay, but I too, when I lie down at night to go to sleep, I really hear it. It doesn't keep me awake, but boy, do I hear it. But anyway, have you noticed that, with COVID? Or I've had people tell me that after they were vaccinated, I mean, even my daughter, since being vaccinated, she's had tinnitus. I have not been vaccinated, but I just wondered if you could talk about that for a second, or if you have any input.
Yeah, and if anybody has any input that they've noticed they had tinnitus after having COVID or the vaccination, and pop up and shout out and tell us your experience as well. It's interesting, Linda, at TAA, Texas Academy of Audiology, which is our yearly meeting, one of the events or classes was on COVID and tinnitus, because we have seen an uptick in responses from patients saying, I've noticed tinnitus and I've noticed, since I've had the vaccine, that I've had tinnitus. And in fact, Alicia just put in the chat box, she said hers began a month after having COVID as well. And again, what they're showing and at that class was that they really couldn't prove or disprove, but I kind of saw a little bit of something going on. Of course, that's my I don't have like the statistics and research for it. Dr. Webster, do you have any other comments on that?
Yeah, I've certainly heard it reported a lot. People will, that's probably the biggest complaint that I hear after somebody has COVID. I am not sure. I thought there was some evidence that it was correlated with extra, an increase in tinnitus cases. But
yeah, I think that was stress related, though, not necessarily COVID related.
Okay. Yeah.
Stress and tinnitus have a lot, and they said like people weren't sleeping as well, which
Sure.
I didn't sleep well during COVID.
Fair enough. Yeah.
I was worrying about my parents and everything, but I don't know for sure if they, from what I took from it, I don't know if they
Yeah.
said it.
And
I don't think they did from anything.
right. And even either way, it's so, you got to take it with a grain of salt because it's just so brand new anyways. Right.
Yeah,
You're not going to
so
have a very, very solid answer for a little bit here.
That's a great question. Anybody else notice anything COVID related with tinnitus? It'd be interesting to like if we could send out like a little 3-question, survey to all of our patients about that. Any other questions? That was a great question, Linda. Thank you. All right, so I'm going to go ahead and announce the winner. So, we got, yeah, okay, so Kay just said, I developed tinnitus a number of years ago after taking a lot of, medication for pain during several dental surgeries, was told it was nerve damage. I learned to live with it. Yep, so that was actually we had, was it last month? I think we had a pharmacologist come in and do a speaking event, and Kay, if you want that PowerPoint, we've got it. And that was one of the things that they said is pain medications can, have a high correlation. That's a side effect. Sometimes whenever you stop taking the pain meds, it'll go away, but sometimes it's permanent and it doesn't go away. So it's a good thing when patients can, get used to it. But some patients, like my dad, he had a very difficult time, getting used to it. And he ended up taking, or is taking, a medication to kind of help him sleep better because it was keeping him up at night. All right. And I'm going to go over all of the gift card winners and whatnot. So for our big gifts, and oh, thank you, Alicia. She said that is a good point. She's been taking some pain meds for a while, never thought they would be related. Yeah. Yep. Absolutely. So I'm going to go over the big gifts. In fact, Brittany, do you want to come, because I need to know which ones are the big ones and which ones are the smaller ones.
We will have a 5 behind you.
Oh, the big ones are the 5 behind me. Got it.
Just any order.
Any order. Okay. All right. So we've got Steven here. All right. So, and it's Steven, Proehl.
Yeah, yes,
All right. So, are you able to come to our Glen Lakes office to pick it up?
I won't be there for another month and a half. So
No
in all
problem.
sincerity, if you want to give that to someone else, I'm more than happy to donate it to someone else, okay?
Okay. Okay.
Thank you,
Absolutely. We
Deb.
appreciate it. All right. And we've got here, is it Gil Gonzalez?
Yes.
Got it. All right. And we've got Judy here.
Hello, yes.
Perfect. So, and just call up to the Glen Lakes office and speak with Brittany. I'll give you that phone number and she can have you come up here to the office and get it. Although everybody today will be receiving, and this can be used on you or a friend, and it is up to $1,000 off a set of hearing devices. So that's what this card is for. Okay. So everybody that attended will be receiving that. And we also have Dennis Wooten here. All right, so we've got Dennis here. And I'm gonna be blocking my face in a second from this. Let me get him on here. And we have the coupon here for, it's RIGHO. And how do you say that? Is it Rigo? All right, and we've got that as well. All right, let me check and make sure we've gotten everything given away. Oh, thank you. Okay, Rigo said that I said it correct. Perfect. Oh, no problem, Rigo. I got you down here. Let's see. Okay, we still have some gift cards here. And Kay, Hayden, we've got a gift card for you here. And then we have Dr. Norris, we have a gift card for you. And then John Davis, we have a gift card for you as well. So give this Glen Lakes office a phone call and speak with Brittany. This number is 214-987-4114. And she will be getting all your prizes to you. And then don't forget, even if I didn't call your name out, you still got that that up to $1,000 coupon. So please feel free to call us and we'll get that taken care of for you. All right. Stephen said, congrats to all the winners and thank you for setting this up. Good to hear from others having the same issues. You know, that's the main thing for a lot of these Zooms, is to know that, you know, you're not alone, that other people are, you know, going through this, and it's kind of like a camaraderie. I mean, I know my dad asked me, is this only happening to me? Why me? You know, and it helps to kind of have a group together. So, All right, well, we appreciate y'all so much, and I want to thank Dr.
Wow.
Webster.
Thank you.
Yes, thank you. And that number is 214-987-4114.
Thank you.
All right, thank you, John. Thank you, Steve.
Thanks, guys.
Good to see you, Mr. Ricks.
Thank you.
Thank you, Linda. We appreciate you. Thank you, Jean. Good to see all of y'all. Thank you, Paul.